Welcome back to Body Beautiful. With us today we have plastic surgeon Dr. Joseph Mele, and we're talking about the top 5 most common plastic surgery procedures in the United States. Later we'll be taking your calls, answering any questions you might have for the doctor. And here's the phone number, 415-561-8753. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And any advice we give you today, you'll certainly want to consult your own physician as well. Okay, we left off at number 4.
Number 4.
Okay, so we had the
facelift and tummy tuck were tied for 5.
Tied for 5.
Eyelids,
and number
4.
Eyelids,
blepharoplasty.
Blepharoplasty. That's why I couldn't do it earlier,
yeah.
and I've been practicing, and I still can't say it. We just call it an eye job, right?
That works.
Oh, okay. What is number 3?
So number 3 used to be number 1 for several years. It's liposuction.
Yeah, I used to hear about that all the time.
Sure.
It got bumped.
It got bumped. Some of the other procedures became a little more popular.
And why is that? I mean, people...
I think it's just natural shifts in the population. As our population changes, the procedures we perform change.
Let's get a look at a picture here of someone who has just had liposuction.
So
this is a good candidate, right?
Yeah, excellent candidate. Really good shape, not overweight, has some fat, really well isolated right to the lower part of the abdomen, and has very good skin tone. So I can safely remove that and still have a nice flat belly.
Okay, so liposuction, not a good solution for weight loss.
No, not at all. It's a terrible solution for weight loss. If we remove fat with liposuction, it's kind of like losing fat on a fad diet. And if someone hasn't changed their habits, they're not exercising more, they're going to gain the weight back. And it may come back in the same place, it may come back somewhere else, but it's going to come back.
All right, and we've heard a lot about laser liposuction, smart liposuction. Does this all get thrown in there, or are you talking about just the traditional?
Well, it's interesting because the laser liposuction, smart liposuction, ultrasonic liposuction, they all still do tumescent liposuction, which is really our workhorse. And I think one of the most dependable ways to do liposuction, if it wasn't for the tumescent, we wouldn't be doing the things that we're able to do with liposuction.
We get a lot of emails, people asking about whether liposuction can rid cellulite from the body. Is that possible
Cellulite,
or no?
Sometimes it happens, but it's not something that can be guaranteed. There are some newer modalities coming out to try and break those connections that are causing the puckering. There's some promise in there, there is some improvement, but it's still not perfect. We still can't like body bond to it and make it smooth.
Okay, is there any advice, diet, liquid intake, wraps?
Diet, exercise are always good, but cellulite is sort of a genetic problem. And you'll find people who are teenagers that have cellulite who are not overweight. It's just the way that their skin is attached.
All right, we're going to encourage those researchers to find a pill or
better
something.
way.
And how about liposuction as a temporary result? I mean, when it's done, is it done? You can eat what you want and not worry about.
No, it's not a license to eat.
Back?
No, you still have to maintain your weight.
No license to eat.
Procedures like liposuction really do take a partnership. And the ideal candidate is someone who's taking care of themselves, who has a stable weight, who has focal areas or lumps just from the fat. Then I can go in there and make the fat go away from those spots.
So your preference is really that they've exercised and they've dieted and they've gotten to basically their optimum weight.
They're at a stable weight.
Right.
I can't say everyone I operate is at the ideal weight, but if they're overweight, they're stable at that, and they are comfortable with having some improvement, but not looking like they're dieting and exercising and being at their perfect weight. I can't do that.
Okay.
In fact, about the most we remove at one sitting is 10 or 11 pounds.
Well, that's a lot.
Which is a lot.
Yeah.
And it has to be there in order to remove it. I can't just remove that from everyone.
All right.